So what is this issue with insulin resistance of fat cells? Well, just like muscle cells, as we explained before, many cells are signaled by insulin to take sugar within them. Fat cells are no different. Now, there are kinds of chemical signals and all that can become disordered, and we can also have inflammation in the body. That can cause the fat cells to become insulin resistant. Now, what results from that? Well, this insulin resistance of fat cells causes a decreased burning of sugar and fats. And it also, the increased inflammation increases what's called leptin resistance. Leptins are a chemical that help to give us a feeling of satiation, that we've eaten enough. But if there's resistance to leptin, then we have this increased appetite, and thus an increase in fat storage, and we can't lose weight if we continue to increase our fat storage and if we aren't burning fats properly. So as our fat storage capacity becomes exceeded, or the fat cells become insulin resistant, the level of fat in our circulation actually increases. So that's in our bloodstream. Then it travels to and accumulates in muscles, arteries, and organs. This causes a fat toxicity because we shouldn't have those high levels of fat in those locations. So we get fat toxicity. It's a lipotoxicity. And this leads to obesity, diabetes, cardiovascular disease, fatty liver, and more. So this number 5, the insulin resistance of fat cells, is another key component of the causes of unhealthy metabolism. And these are things that in our program we help to address in a very effective way so that we can turn this around and get the body to work more properly, and so you can lose weight and keep it off. The next thing we'll talk about is what happens when white blood cells start infiltrating the wrong places. And white blood cells, of course, are part of our immune system, what protects us.